Diabetes is increasing worldwide. Number of diabetic patients requiring treatment for heart disease, stroke, kidney failure, needing dialysis and renal transplant, retinopathy and blindness, neuropathy, foot ulcers and amputation, dental problems, dementia, mood disorders, etc. are also increasing. Majority of patients who need dialysis are diabetic. 75% of the death in people with diabetes are due to heart attack. Around 600 million people are living with diabetes, and estimated treatment cost comes to around 760 billion US dollars per year. Even if we are spending such a huge amount for treatment, why is this disease increasing? Why can't we prevent or reverse this disease? Even those who take medications and insulin injections regularly develop complications like nephropathy, retinopathy, neuropathy, non-healing ulcers, etc. Let us understand the awareness needed to reverse diabetes and prevent recurrence. Health tips are not the focus here. Rather, the effort is on providing information that will help to understand the causative factors behind diabetes, measures for early detection, tests to assess the current status of the disease, present treatment options in modern medicine with their benefits and limitations. Also, I will try to convey the fundamental relationship of this health condition with the lifestyle and the impact of correction of lifestyle has on reversing and preventing recurrence of diabetes. This is why the video may appear long. To help you save time, we have stamped the topics in the description below for those who would prefer it. Here, the focus is on those who would like to make more informed decisions on matters concerning their health. This is important, especially when they would like to avoid surgery and chronic medications with added effort from their part. First, we should know what is diabetes. Basically, there are two types of diabetes. One is type 1 and next is type 2. Type 1 diabetes is due to the pancreas is not producing enough insulin. So the insulin level is low in type 1 diabetes. Usually that starts when the child, during the younger age, the childhood actually starts. And or if you have to remove the pancreas because of some tumor or something like that, the pancreas cells are removed, so there is no insulin. That is type 1 diabetes. Next is type 2 diabetes. Type 2 diabetes is usually occurs in older age, adult. It's commonly called adult onset diabetes. This is because of when you are growing, when you are getting old, you would accumulate more toxins, especially in the form of fat. You are getting bulky and obesity and coming. And because of that, the insulin is not working. That is the reason for the type 2 diabetes is not lack of insulin. And it is due to the insulin is not working properly. That is the reason for type 2 diabetes. So this both should be treated in a different way. Another type of diabetes is gestational diabetes. Actually, gestational diabetes is also type 2 diabetes. They take insulin injection or use an insulin pump and take more calorie food and they become obese or accumulate fat or even overweight. Then this type 1 patients can develop type 2 diabetes also along with that. That means even if you take insulin injections, the sugar will not come down because of the insulin resistance. So that is also a possibility. Everyone should understand that type 1 diabetic patients should maintain a low-calorie diet. Again, they should see that they are not increasing their weight. Their fat content, the composition should be optimal. Next, we should see what are the symptoms of diabetes actually. The symptoms is generally speaking polyuria, polydipsia. That is, you feel hungry, you feel thirsty, and you drink a lot of water or juice and all, and you pass urine frequently. That is the typical sign. But that occurs only in the later stage when the sugar level is 300, 400, etc. In pre-diabetic stage, that is before starting the glucose is increasing, you can get some symptoms like acanthosis nigricans. That means you get a darkening of your face or between the knuckles of the fingers or the axilla or the private parts area. You get a darkening. That is called acanthosis nigricans. That is a sign of insulin resistance actually. In type 2 diabetes, actually, not the glucose is increasing first. Actually, the insulin is increasing, and this insulin is making these acanthosis nigricans or the hypertrophy of the skin cells and all. Next sign of this pre-diabetic sign is abdominal obesity. And a person with abdominal obesity or obesity and seeing this darkening of the skin, you should definitely look for whether you are getting diabetes. Next to the major symptoms of renal failure and heart attack and all comes like that is the sign of organ damage. That all comes in the after 10 or 20 or 34 years after the initial diabetes is started. Next is the diagnosis part. How can you diagnose? You are suspecting a diabetes or a pre-diabetes. How can you diagnose it? For that, you have to check one is glucose, blood fasting glucose and postprandial glucose test. More importantly, HbA1c, that is the average of the 1 month, 30 days glucose level you are getting. So if you are checking only the glucose, you may miss the diagnosis, because when you go for a testing, you will have some control and you will eat less glucose and sugar and all, avoid for a few days and then go for checking. Then definitely the glucose level, because it is reflecting the 24 hours or 12 hours glucose, what you are eating only, or what is your activity and what you are eating. But the 24, this HbA1c give you an overall 90 days to 120 days average. So that will be a better diagnostic factor for the diagnosis, especially in the early stage. Then if you see that your glucose level is high and the HbA1c level is high, then what should you do? Next, you have to check whether it is type 1 diabetes or type 2 diabetes. Generally speaking, if it's an younger child, you are saying that age of 2, 6 or 12, 14 years and all, if you are showing a high sugar level, it can be a type 1 diabetes. But in adult, if you are seeing high glucose level, then it can be type 2 diabetes. To differentiate between the type 1 and 2, you have to check the insulin level. And if you are already on insulin, you are diagnosed with diabetes and you are taking for the last 10 years or 15 years, you are taking insulin also, then if you want to know whether it is your type 1 diabetes, actually insulin is needed only for the type 1 diabetes patient. If you want to know whether you are type 1 diabetes or type 2 diabetes, you have to check the C-peptide level while you are on insulin. And the C-peptide is a part of the insulin, and it is taken, when it is activated, it is removed. But when the insulin you are taking injection form, you are taking the insulin, then it doesn't have a C-peptide. That's why if the C-peptide level is okay, that means your body is making insulin in the normal way. Next is what is the problem with the high glucose? How it affects your health? Why diabetic patients are getting sick? Actually, what happens is, when the glucose level is high, the glucose is traveling through your blood vessels, and it is sweeping, going out to give all the cells in the body the enough sugar for the body, and also all the other nutrients are going through the blood vessels. And actually, the blood vessels are the roads for our body. So, the maximum impact of high blood sugar is happening in the blood cells, that is RBCs and the white blood cells and the lining of our blood vessels. When the lining of the blood vessels get damages, that is actually creating problem. That is which is leading to microangiopathy, macroangiopathy, atherosclerosis, heart disease, and all the complications of diabetes is because of this damage of the blood vessel to different organs of the body. And what is actually this HbA1c? You look for the intensity to see the intensity of the diabetes. No? So HbA1c means glycosylated hemoglobin. Glycosylated hemoglobin is the pigment which is carrying oxygen. No? So this hemoglobin is getting glycosylated. That means if the patient is having, if a normal person should have only around 5 to 5.5 HbA1c or below that HbA1c, that means that much glycosylation, that is a natural cause of aging of the cell, that the aging of the RBCs, by the process it may be get glycosylated, that is it. But if the patient is having, if a person is having 10 HbA1c or 15 HbA1c, that means 15% of their hemoglobin is glycosylated, that is damaged. That means they have to be, that cells are already damaged, it has to be replaced with the new cells. So not only the RBCs or not only the hemoglobin, it represents the whole body actually. If HbA1c is 15%, that is hemoglobin is 15% of the hemoglobin is damaged, means your whole body's cells are damaged in all the other proteins also. It's only protein, a type of protein. The other type of proteins also is getting damaged. That is why this diabetes is affecting all the organs of the body. Next is what type of patients get the diabetes. Every patient is not getting, no? Only some patients are getting. The first thing is the genetics. If you have your parents having diabetes or it is running in the family, definitely there is chance for you to get the disease, because some mutations are already happened in your body, which is predisposing for you to get a diabetes. Next is your lifestyle. Even if your parents are, both of the parents having diabetes, you may not get the diabetes. If you live a healthy life, you may not get the diabetes. The next is what you eat and how your activities are going. If you are eating more junk food, like more calorie, biscuits, fries and all, sweets, the chance of you are already genetically predisposed, and then definitely you can get the diabetes. And also if you are obese, obesity is another predisposing factor. Another thing is sedentary lifestyle. If you are not exercising and you are eating more, definitely the lifestyle, getting diabetes is higher. Next, what are the other diseases which can promote diabetes? Usually, diabetes is a part of metabolic syndrome. Metabolic syndrome means obesity, diabetes, hypertension, and dyslipidemia, especially that high triglyceride level and low HDL. That is the definition of metabolic syndrome. It may be the hypertension comes first, or the diabetes comes first, or in vice versa. Anyway, if a person is diabetic and they start on medication with diabetes, then after within few months or years, they will get hypertension also. And also chronic liver disease like fatty liver and liver cirrhosis and also is common along with it. And next is kidney patients can get diabetes, and diabetes patient kidney problems can develop. Then is thyroid. Hypothyroidism, especially the Hashimoto's thyroiditis is one. This is always accompanied or commonly seen with the diabetes. Arthritis, both type of arthritis, this rheumatoid arthritis and also osteoarthritis, and also this gouty arthritis. So next is depression, anxiety, and psychological manifestations. Psychological manifestations can occur in the diabetic patient, and also those who are taking the psychology medicines like for depression and schizophrenia and all can develop type 2 diabetes, especially because of the accumulation of fat. Because when they are taking a psychiatric medicine, you will feel lethargic, you will be less active, and you will feel more hunger, and you will eat more. So anyone who is taking psychiatric medicine should very specifically do exercise and see that you are not gaining weight and fat. And if you are gaining weight and you are becoming more fatty, you will get insulin resistance, and type 2 diabetes possibility is high. Next is about the disease. It is the complication. What are the complications which can come? All the complications of diabetes is mainly due to the blood vessel damage. It can be macrovascular or microvascular. Macrovascular means big blood vessels like a coronary artery or the carotid artery or the abdominal aorta, where because of this glucose and damage, and also it's always glucose, high glucose will be accompanied with the high triglyceride also. So this fat will accumulate in the get deposited in the blood vessels, and the blood vessel will be blocked, and that is called atherosclerosis. So if the coronary artery is getting clogged, Then we do an angiogram and see there is 40%, 50%, 60%, 90% block are there. You put a stent, and if you are not able to put a stent, you do the bypass surgery. So that is macrovascular disease associated with the diabetes. And we can see that most of the patient comes to the cardiac ICU with an attack or a chest discomfort or undergoing TMT, or most of them will be having diabetes also. Next is microvascular disease, microangiopathy. Microangiopathy, this retina. One of the eye problems are mainly because of the microangiopathy. To get the vision loss and retinopathy, and vision loss happens only in the late when the macula, the central part of the vision, is affected. Much before that itself, you can, with the fundoscopy or ophthalmoscopy, you can see the inside of the eye and the retina, and the microangiopathy can be visualized. And at that stage itself, if you are able to correct the blood sugar, you can reverse the changes in the initial stage if you see. But if the macula is affected, then it is very difficult. You won't be able to reverse the damages done. And also the nephropathy, that also because of the microangiopathy, because the unit of the nephrons, the kidney, the nephrons, it is all small blood vessels. It's a coiling of the blood vessel, coiled small blood vessels actually. It works as a sieve for the blood. So that is get affected. That is the reason for the nephropathy. And also this albumin leaking inside the urine, it just comes because of that. Next is actually this cardiomyopathy also can happen. That is because of the small blood vessel. If the large blood vessels, you get a heart attack. If the small blood vessels, you get cardiomyopathy. And silent attacks also, small blood vessels, silent attacks also can happen. And also the silent attacks also can happen in the brain also. That also can lead to dementia and Alzheimer's disease and the problems like that. Then is the sensory changes, the dermopathy and the sensory neuropathy, the hearing problems. That is if the nerve cells, actually the nerve cells also needs blood and glucose and all. So small blood vessels are there throughout it is actually covering it's passing along with the nerves. Even the thin nerve cells, nerves get the blood circulation through the small blood vessels. When these blood vessels are damaged, you get the peripheral neuropathy. That is typically called the glove and stock. That is tips of the part which is covering with the gloves or the socks. You get the sensation. Usually you get a loss of sensation. Even the tongue, when many of the diabetic patients, when we complaining of the taste, and not enough in India, especially in Kerala and all, they are using very spicy food, and they'll be complaining, even if it is very spicy, they won't feel the spice, and not enough salt and not enough spices and etc. That will be the usual complaint for the diabetic patients. That is because of the sensory neuropathy affecting our tongue and taste. Next, proprioception. That is another aspect of the sensation, is the proprioception. That is the receptors inside your joints and the nerves. And if it is affected, you feel that balance problems can occur. Next is autonomic neuropathy also can happen. That also can affect the balancing problem can come. And also the usual gastric complaints like a gas and constipation and all, because of there is an enteric nerve system inside your gut actually. And if that is affected, there is a problem with the nerve wiring or the nerve supply, then you can get this gas and intestinal problems also can occur. Next, let us see about the macrovascular problems. First, initially we have said about the coronary artery problem, which is plaques comes, you can get a heart attack and all. And also if it is comes on the carotid artery, that is the supply to the brain, you can get a stroke, or a narrowing of the blood vessels can occur that can reduce your intellect and problems, and even dementia. Such problems, dementia, usually with the microcirculation, but if the major block is in the carotid artery, also can reduce the blood supply to the brain. Next is this muscular myopathy can occur because of the muscles also needs blood circulation. No? If the muscles, blood vessels are affected, muscles get damaged. diabetic myonecrosis actually. And that is even the blood vessels supplying the leg and limbs and all. If there is atherosclerosis, you can get intermittent claudication sort of pain. When you're walking for a long some time, you get pain on the calf muscles or the thigh muscles. That means there can be claudication pain. That means there is atherosclerosis of the blood vessels itself. So I think nowadays those patients with claudication pain and all, you do the angiogram and put stent and all. It's very common nowadays. But usually even with the stent, it's the pain usually initially for sometimes 1 or 2 months disappear, but it will usually restart coming, because that all the blood vessels, they enter blood vessels, no? So only the major blood vessels you can correct with the stent and all. But if the minor blood vessels affected, you cannot correct it with the stent. Even after the stent area also may be having this atheroma. That is the reason why even if you put the stent, you are not getting a relief. Next is diabetic foot. Diabetic foot and foot ulcers develop also because of this damage to the blood vessels. Major blood vessels it can produce, it can reduce the circulation to the foot. That leads to the amputation and problems like non-healing ulcers, gangrene, amputation and all, is because of this angiopathy and neuropathy actually. Along with the other organs, the reproductive organs can also get affected. And so the male and female infertility, if one of the major factor of infertility also, most of the cases, pre-diabetic and diabetic patients, and as it is very common to have infertility issues also. And even the patient is conceiving, if you're a diabetic mother, the chance of pregnancy complications also is very high, like IUG, intrauterine growth retardation, pregnancy-induced hypertension, and preterm delivery, and all sort of complications also high with the diabetes. Next is, what are the investigations needed for the diabetes patients? Once you can diagnose the diabetes with blood sugar, HbA1c, and you can find out which type it is by insulin and C-peptide. But next what you have to do is, you have to see what is the condition of your organs, how much diabetes has impacted on each organ. For the heart and blood vessels, you can check a CBC, that is a blood count, that is the blood cells. Actually, blood is it's a flowing tissue, and you are taking it out and you can examine it. So the blood cells gives an idea about the condition of all your system actually. And also CRP and HSCRP, ESR, these are the inflammatory markers. Diabetes is almost all the diseases are of inflammatory origin. So you have to see what is the inflammatory markers, what is the level of the inflammatory markers like CRP, HSCRP, ESR, etc. And also for the heart specifically, you can check for a troponin level. And also there's a plaque test, that is to see the activity of this atheroma, how much it is there and all. Next is the organ damage, to see the kidney function. Kidney is one of the major organ affected actually. And kidney function, you can check in the initial stage to find out, check for the GFR. If the GFR is coming down below, it should be above 90 for normal. And if it is coming down below 90, 80, 70, 60, that means your kidney is getting affected. And another thing is albuminuria, that is loss of protein, albumin in the urine. And all other parameters like other functions also is important. And another important aspect is, if the uric acid is increasing, this is generally a trend to go for treating the uric acid to come down, to block the uric acid production in the body. Actually, if the uric acid is going high, and if your person is not of a gout patient, it is no need to go for treating. Actually, not pharmaceutical solution should not be, it is not needed actually, to see that what is the condition of the kidney and correct accordingly, adjust the diet accordingly. To assess the liver is also important. No? So diabetic patients definitely will be having some fatty liver, or even going into fibrosis, or even hepatitis, non-alcoholic hepatitis. Definitely alcohol is also is using, definitely alcoholic, but and again non-alcoholic. It's all added on the impact on your health on liver. Next, this very common is vision loss and problems with the eye. Diabetic patients, diabetic patient, eye can be not only the retina, this lens can be affected and the cataract can come, and also the iris and this flow mechanisms can be affected, and glaucoma can occur. So eye checking and taking this retinography and see and recording it is very important for diabetic assessment, because if the central part of the retina, the macula is affected, you won't be able to revive the vision. So before that, years back, before itself, you can see the retinal changes, and if you correct the diabetes, if you correct the blood sugar, you'll be able to save your vision. Another important aspect of microangiopathy affecting the heart is cardiomyopathy. Actually, in these patients, when you suspect a cardiac problem, you are doing a routine TMT test. TMT may be positive, but when usually TMT positive, you go for an angiogram. Usually, doctors suggest. When you look for an angiogram, there will be no block, but the TMT positive. That means your minor blood vessels, small blood vessels, you are affected. The angiogram will pick up only the major blood vessel blocks will be there, or arthromas are blocking the major blood vessels. That only reflected in the angiogram. But if the patient is TMT positive and angiogram negative, means there is microangiopathy of the heart. So that also can be corrected only through the lifestyle correction. Next is dermopathy. Most of the diabetic patients will be having some skin problems, especially after 20 or 30 years. They will get darkening or reddish patches and itching, burning, all sort of things will be there. That is because of the damage to the skin cells, because of the blood vessel damage and the direct cell damage. Then the major problem is erectile dysfunction also. That is, sexual dysfunction can occur. That is because of the for the sexual function, the blood circulation is needed. When the blood vessels are clogged with atheroma and damaged, definitely sexual dysfunction and erectile dysfunction can occur. And next is periodontal disease. Actually, the dental problems are very common with the diabetic patient. That also, because of the blood vessel damage, the tooth also getting nervous connection and blood circulation is there. There's a part of the tooth which is growing and replacing the damaged cells and all. It's also growing actually, or there is a growth part taking place. And that blood vessels or the nerves is damaged, that can affect. And also the gum, and because of the high sugar level, that the mouth and the saliva and all will be having high sugar level, that will give a ideal atmosphere for the bacteria and all the microbes to grow, and that also giving gingivitis and damage to the tooth. That is the reason for many of this tooth decay and tooth loss and all. Next is another test which is usually done for the diabetic patients is nerve conduction study. That is mainly for the peripheral neuropathy. And when the sensation is, how much sensory loss is there to assess, we can do a nerve conduction study. For the peripheral neuropathy assessment, especially for the extremities, hands and the leg, you can assess the nerve damage using a nerve conduction study, or sensory assessment of the foot, and the especially for the foot care, that sort of sensory assessment is done. Next, we can discuss about the treatment, that is medical treatment. Surgical options are there, and also the limitations of the medication and surgery also we can discuss. Primarily, when you diagnose with the type 1 diabetes and the insulin function, pancreas is not producing much insulin, then you have only one option: take insulin injection, and limit your food, and if you take 4 times food, you take insulin for 4 times. If you take 2 times, if you can adjust with the food, then you need only 2 times food. But usually people are taking 4 times insulin and 4 times food. That is the pattern I am seeing with the prescriptions seen from outside. So make sure when you're taking insulin, one thing you should understand is there are 2 types of insulin mainly. That is, one is natural human insulin. It's not natural. It is produced by the biotechnology methods, by the E. coli bacteria. And another thing is analog insulins. Analog insulins are made of amino acids. If 1 or 2 amino acids are put in a different changes are in the pattern of amino acids on the the polysaccharide pattern. So that is the way it is these analogs are produced. But it doesn't have much benefit over the natural insulin. There are two types of natural insulin itself. One is long-acting, short-acting, and combined. It's a long and short-acting combined insulins. It is always better to use the human insulin, which is produced by the recombinant methods. But what is the problem with the analog insulin is, it may give some little advantage and all, may be protected, but actually it is the genetics or the protein composition is different from the natural insulin. So always go maximum to the natural insulin. The analogs are actually deviating from the nature, so there is chance for getting resistance and also getting autoimmune problems, develop immunity against the insulin. So it always safe to go for the normal, more natural, more best. The diabetic medicines, most of the medications are usually increasing the insulin secretion and increasing the insulin production. So, and also, as you know, for the type 2 diabetes, we use insulin also. Actually, there is no deficiency of insulin in type 2 diabetes. So there's no need for, it is not correct for increasing the insulin level in the body, either by the tablet or by the insulin injections, because hyperinsulinemia itself is a problem for the body. Even when the insulin is getting high, your immune system will go down. This phagocytosis and the mitosis, and there are so many mechanisms involved in the immune system functions. When the insulin level go high, the immune system immunity will come down. So the diabetic patients with the high, they're already prone for infection because of the high glucose, which is prompting bacteria to get in and flourish. So we should avoid increasing the insulin also, increasing the level of insulin also to be avoided in a type 2 diabetic patient's treatment regime. There are other new type of medicines which is actually increasing the excretion of the glucose through urine. Actually, that is a boon actually. But the problem is, if you take more carbohydrate and you eat more as you like, all the fruits and vegetables and cereals and all, and then taking this tablet also to pass it over the urine, the urine will become a culture media. So there is a chance for urinary infection and also the kidney infection, pyelonephritis, and all sort of infection for the urine and also the private area. Private area will be always sugar level will be high, because when you pass urine also the this urine will be like juice, which is so sugar tasty. But if you put some sugar as urine to open area, and where the ants will come and attack the urine actually, because there's the sweetness, they will attract you towards it, especially those who are taking the diabetic medications which is increasing the urinary output. But it can be used very judiciously for initial stage or just to get the control. That time we can use that. But otherwise it should not be using as a regular medication actually. Next is for if your neuropathy is there, you have to take painkillers. And also if you have cardio problem like that, your cholesterol is high or triglyceride is high, to take medicine for that cardiac patients. Usually they are on aspirin and things like that, blood thinners and all. But there is a problem that the major problem with this taking multiple medication is the drug interaction also. If a patient who is on hypertensive, means they are hypertension, and the same person is, if you are taking aspirin and clopidogrel or any blood thinners, the chance of getting a stroke is high, because a minor bleed can become a major bleed and accumulate bleeding. Stroke can be the minor bleed can and as minor stroke can become a major stroke if you're diabetic patient, and also hypertensive, and then you're on blood thinners also. And also another aspect of the anti-statins like medication for cholesterol, it is actually when the liver is the person who's the organ which is producing the cholesterol. Cholesterol is an essential part of the our metabolic system to make sex hormones, vitamin D, bile salt, and even it is an integral part of the new cells, which is generation of the new cells also. So if you are taking statin and blocking that, the liver will feel the strain, because the liver is the organ which is mainly producing the cholesterol. So a person who's already fatty liver and fibrosis, and you are giving statins to that person, the liver problem can be aggravated. And also we should remember the drug interaction and things, because if a person is having diabetes, the liver and the kidney can be damaged. And when you take a medicine, either for diabetes or for kidney disease or for heart disease, it all has to pass through the liver, and liver has to metabolize it. And also it has to go through, the metabolite has to go through the kidney, and kidney has to excrete it. Everyone who's taking medication should remember that point also. Next is surgical treatment for diabetes. Nowadays, obese patients undergoing this bariatric surgery, removing a part of the stomach and bypassing, removing a part of the small intestine, and all such surgeries are there. Then the other surgeries are for dealing with the complications of the diabetes, like heart block, stent, or the arterial block, a stent is put, or a bypass surgery, or organ transplantation if the kidney is failed, or a dialysis if the kidney is failed, or for the ulcer care, ulceration is there, ulcer care, and this amputation if it is necessary. Those are the surgical measures. Now we saw all the problems with the diabetes and all the problems with medication, insulin, and surgeries and all. Now, what is the real solution for this problem? Then we had to know what is the real problem, what is the reason for the diabetes. Is for the type 2 diabetes. Type 1 diabetes, already the insulin production is not there. Your only option is to take insulin injections and control your lifestyle, do exercise, moderate exercise, and consume moderate carbohydrates and other food items, and control the blood sugar with the insulin. But for the type 2 diabetes, you should understand the problem is the excess carbohydrate, excess calorie, and lack of exercise. So you have to correct the root cause, that is your lifestyle. And it is for the type 2 diabetes, it is not the medication or insulin is the answer. It is your lifestyle correction is the answer. You can diagnose the diabetes in pre-diabetes stage itself. Actually, the pre-diabetes stage itself may be running 10 or 15 years. So it's easily correct your body parameters and the body composition. Actually, the reason for the type 2 diabetes and the insulin resistance is the accumulation of excess fat in the body. You do the exercise, control your calorie intake, and reverse the diabetes when it is in the pre-diabetes stage, or when you are diagnosed with diabetes, and if you are initially started with 1 or 2 medicine also you will be able to correct it by yourself. If you are having too many medications like your insulin and too many diabetic medicine, 3-4 diabetic medicine, 3 or 4 BP medicines, and along with that you have fatty liver, kidney, GFR is coming down, CKD is there, and you are already on heart attack, you had a heart attack, or you had a stent already put or a bypass, then you won't be able to do by yourself. Then you have to take a clinically supported lifestyle correction. But if you are in the early stage and you are not on much medication, or you are in the pre-diabetic stage, you can take a self-correct your lifestyle. And mainly you do some exercise and also reduce the calorie intake. What is a practical diet for a diabetic patient? Actually, if the sugar level is high, it goes to take only leafy vegetables. And if you're taking non-vegetarian, if you're a non-vegetarian food doesn't contain much carbohydrate. So leafy vegetables and the non-vegetarian items like fish, meat, and egg should be your major food content. And when the blood sugar is controlled, you can add the pulses also. Then if your HbA1c also come down, and your fat level also comes down, your obesity is managed, Then you can add other fruits and ordinary vegetables. Ordinary vegetables and fruits also are good in rich in carbohydrate. So that also added only after the blood sugar is controlled. Then when your body is, the excess fat is gone, your HbA1c come down, your sugar is come down, then manage with to maintain that according to your physical activity, and see that your blood parameters and your body parameters like your weight should be kept in the optimal range. Now we have talked about the different aspects of the diabetes, and now we summarize it. In brief, 1. If you suspect diabetes or pre-diabetes, check HbA1c level along with blood glucose level. 2. If an adult person is diagnosed with diabetes, check the insulin level to understand whether it is type 1 or type 2 diabetes. If insulin level is normal or high, it is type 2 diabetes, and if insulin is low, it is type 1. 3. If you are a non-diabetic patient on insulin, check the C-peptide level to differentiate between type 1 and type 2 diabetes. 4. In children, if glucose and HbA1c are high, and even if the insulin level is normal, it can be an early stage of type 1 diabetes. It may take 1 to 2 years for the complete destruction of the islet cells of the pancreas to show low insulin levels. We may be able to prevent the progress of the immune process and destruction of the insulin producing cells and insulin dependence if we are able to correct the immune system by modulating lifestyle parameters in the early stage itself. 5th point is, in patients with normal or high insulin level or C-peptide and high blood sugar and HbA1c, the problem is type 2 diabetes. Here the insulin is not working properly due to insulin resistance. Gestational diabetes occurring during pregnancy also comes under type 2 diabetes. 6th point, hyperinsulinemia associated with the type 2 diabetes and its medication and insulin injections lead to weight gain, fat accumulation, and further increase in insulin resistance and aggravate the disease process. 7. Type 2 diabetes patients should concentrate on calorie reduction, fat burning through exercise, and weight reduction while ensuring optimal nutrition from a low-calorie diet. 8. Insulin injection is needed for type 1 diabetes patients with very low or no insulin production. But if a type 1 diabetes patient gain weight and accumulate excess fat, insulin resistance also sets in. In such patients, blood sugar control becomes difficult in spite of timely insulin injections. 9. One cannot reverse type 2 diabetes with the medication. But if the patient is willing to modulate lifestyle, food habit, and activity pattern, one can reverse type 2 diabetes. But if the organs like kidney, eye, brain, nerves, etc. are severely damaged, repair and reversal of the organ damage may not be possible. 10. The internal lining of the blood vessels are the one affected first and get damaged with the increase in blood sugar in diabetes. The complications associated with diabetes depends on which blood vessel, which organ is damaged. If the eye vessels are affected, retinopathy, kidney vessels, nephropathy, likewise. 11. Food items containing carbohydrates like cereals, fruits, vegetables, etc. should be avoided when the blood glucose level is high. 12. Then the question is what to eat. Leafy vegetables, egg, fish, meat, pulses, etc. are taken in moderate quantities. When the glucose level reaches normal, add moderate quantities of vegetables. When the body weight and body composition comes to normal, according to the level of physical activity, you can add moderate quantities of fruits and cereals, taking care that glucose is in normal range. This information should assist you to understand and prevent lifestyle diseases, to help detect them at the earliest when present, and correct the lifestyle to reverse them. Also, it can be understood why medication and surgery cannot reverse such disease condition. It is not the lack of medication or surgery that create the disease in the first place. This is why it is essential to understand how suitable lifestyle changes can only reverse these diseases and, more importantly, prevent their recurrence. Before any invasive interventions or surgery, it is essential to understand the underlying cause of the disease, what purpose the surgery serves, the on-table and post-operative risk associated with the surgery, associated possible negative impact on future quality of life. This has to be understood not only by the patient but also the associated stakeholders who are usually those who need to support the patient and share the consequences as well. Very often, there is poor understanding on whether the surgery provides recovery or relief and whether the surgery prevents recurrence. Nowadays, health insurance is very common. This provides an opportunity to undergo surgeries without fear of any financial stress. This consumerist outlook guides many to be opportunities and take advantage of the surgical options available primarily on the financial viability angle rather than on an overall picture. This is where the statistics that often provide us the huge percentage of unnecessary surgeries done on unknowing patients deserve maximum attention. Before every surgical intervention, the patient or guardian actually signs the document acknowledging the possibility of undesired consequences or even death from the intervention. This document of acceptance is to be read and understood before fixing a date for any surgical intervention. One should understand that any surgery is contraindicated by chronic lifestyle diseases, and if the advantage of reversing them with the lifestyle modulation before deciding on need for surgical intervention is considered carefully, it will be possible to avoid the need for majority of our surgical interventions. We need to be proactive in health and not wait for the disease condition to reach a stage where we lose hope of the ability to actively reverse our health problems with a self-modulated lifestyle correction. Otherwise, we will have to remain an outside observer in the effort to recover health. Very often, never getting a clue of what the numerous healthcare partners are actually doing for your health. Very often, the core of improving body composition, metabolism, and immunity are never possible when you remain an outside observer. And this is what I hope will be the game changer for those who want health over conventional patient care. Another important aspect is when someone is talking about healthcare and newer treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from the government service and in 1997 started practicing as consultant at Life Care Center, Thevara, Kochi. I focus on lifestyle modulation with clinical support, minimizing medication and surgical intervention for lifestyle diseases. The focus was on understanding the effects of modern pharmaceutical drugs, surgical interventions, and physiotherapy on immunity. Based on the knowledge on the functioning of the immune system, developed nutrition formulas and body conditioning protocol named Oxyflex for optimizing circulation, stabilizing neuronal, hormonal, and immune activities. Optimized nutrition along with the Oxyflex is the foundation of the cell activation protocol, a clinically supported and supervised lifestyle modulation method for optimizing health, delay, aging process, prevention and reversal of lifestyle diseases like diabetes, hypertension, heart disease, allergy, asthma, cancer, autoimmune diseases like thyroiditis, arthritis, psoriasis, etc., thereby reducing the need for medical and surgical interventions. Next, let us understand what is clinically supported and supervised lifestyle correction. Step 1 in this approach is to understand body composition and fat tissue status to help determine desired body composition. Step 2 is to conduct laboratory tests to evaluate the health status of the organs of the body like a heart, liver, kidney, pancreas, etc. The status of the systems like circulatory, immunity, endocrine, metabolic, etc. And the compatibility status of the food consumed or generally available. Step 3 is to identify what lifestyle modulations can help achieve the desired body composition. Patient-specific conditions will help decide on the effort at optimizing nutrition, physical activity, and the prevention of toxin accumulation. The focus is to create an enabling environment for the cells of the body to regain and retain optimum metabolic activities. When lifestyle modulation restores and retain optimized circulation, metabolic activities, hormone balance, immunity, and body composition, most lifestyle disorders can be overcome. When those who have been on medication for a long time and who have not reached the stage of irreversible organ failure are ready to modulate lifestyle to benefit from nutrition, the health, the repair, and replacement of sick cells, protection from exposure to toxins, improved circulation through controlled physical activity, it is possible to prevent or overcome vast majority of the lifestyle diseases like diabetes, hypertension, angina, cardiovascular disease, allergies, asthma, arthritis, autoimmune disease, cancer, etc. This also helps to avoid the need for medication and surgeries. Next, you may be interested to know what is the result of clinically supported lifestyle correction. I am basically giving clinically supported lifestyle correction for those who are having multiple lifestyle disorders like hypertension, diabetes, arthritis, and usually the diabetes comes together. Diabetes is coming not alone. There may be other siblings also like cardiac disease, hypertension, cholesterol, dyslipidemia, etc. I can give you a few examples also of my treatment experiences also. This is a 62-year-old man. The height is 162 centimeters and weight is 58 kg. And actually he is dived for many years, almost 26 years. And he is on medication for a long time, taking 3-4 diabetic medicines and also medication for hypertension, cholesterol and all. And when he comes, actually his sugar was 463 actually when we start treatment actually. This 463 sugar level is when he is on diabetic medications. Now he's very diligently he is taking the medicines. And his HbA1c level is 13.4. And even in spite of taking cholesterol medicines, his cholesterol is high. And even liver function tests are also abnormal. And when we come to the result, actually that is within 24 hours itself he has come down his blood level to around 200. And 48 hours he's reached our optimal value of 140 actually. And when usually we check the HbA1c level in the 8th day itself. Usually it is taken us in 3 months and all in India, and we have only the test is freely available, and it cost around 300 rupees only. So we do when a person is in a lifestyle correction, clinically supported lifestyle correction, initial stage every week we check the HbA1c also, and the first day, the day 0 or it was 13.4, and in the day 8 it come down to 12.6, and day 15 it came down to 11.4. And day 30, 9.6, day 60, 7.3, and day 90, 6.4. And when he come for day 120, it is 5.7. So that fast it is coming down. And this is a very ideal patient. He never gone very high blood sugar level in between. And we have a cheat day is there, or weekly once he can take whatever he wants. Otherwise, he has to restrict a low-calorie diet. and only on those days only he goes to a little higher level of grow. But as you see, this 24 this one the overall value HbA1c is coming down. That is the most important thing you have to note. I can tell you another patient story also, that this is a lady of 55 years and her height is 155 centimeters and weight is 57.1. And she is known for non-diabetic for 10 years, dyslipidemia, hypertension, all problems are there, but she never took any medicine. She has taken some medicines and all, but she doesn't like to take medicine. And the problem is now she has had a chest pain, and she was admitted in a hospital, and they asked for it was proved that it is a heart attack, and they asked for a angiogram and stent or bypass, whatever after is possible after, but she was reluctant. That is why she came to me. And when we look into her troponin level, actually they got discharged from the hospital on their own bill. And I was only after coming here and it took the blood level, and I saw her troponin level is more than 8,000. So, and her HbA1c is 9, and she had blood sugar was 309, and HSCRP also was so high, that is cardiac marker HSCRP also 269, and ESR is 118. So many parameters, and sodium was low, and she was really in pain also. But that time I was not knowing that it is her troponin level also was high. Because anyway she is not willing for any surgery or any other medication. So we has given this sorbitrate, that is sorbitrate tablet for the sublingual tablets, and for acidity medicine, and he has given the first day. And after the next day only she started the treatment, and clinically, because she came only at noon and we had to start the morning only. So the change is actually, we have to see. And the day 1 it is HbA1c 9. Next 8th day it is 8.6. The blood sugar has come down within 24 hours. When she came for the second visit on 8th day, it was only, that is random blood sugar is only 118. And the 15th day HbA1c is 8.9. 30th day 8.1. 60th day it is 6.7. And 90 days it is 6.1. And when she on the 120 day it is 5.5. So that fast is the, and also along with that, the troponin level is also coming down. This 8th, when she came on the 8th day, the troponin has come down from 8,000 to 1,000. And in the 15th day it is come down to 158. And on the 30th day it is 10.9. So, and in the 60th day it is 4.2. So, and also all the other parameters like triglyceride, cholesterol, everything has coming down. And the patient is also, the 8th day itself, the patient was comfortable, symptomatically free. And her, when she came, her age, the calendar age is 55 years, and her body age was 58. Actually, in the 30th day visit, it is come down to 56, and 60 days 54, and 90 days it is 53, and with 120 days it is 51. So he is actually ready. The body also is changing. That the accelerated body aging also is got reversed actually, and her body weight also came down from, actually body weight came down from 55.4 to 53.4 only. But even with such less weight reduction, her body age changes also. It's almost, she is able to come down 6 years within a short time. And all the blood parameters and the sickness parameters are corrected. That is the difference between, if you are taking medication, you will not get such a result. If you are willing for a lifestyle correction, then you can get the result. That is the importance. One more patient actually. She's actually 148 centimeters height, 60.5 kg, And she's non-diabetic for 29 years and take hypertension, thyroid, kidney disease is there, GFR is low, and fatty liver, and so many other. We are taking in point of diabetes only mainly. And when we started, she's taking 16 medicines, including insulin, 3 or 4 times. And then with that insulin and 3-4 diabetic medicines and hypertension medicine and everything is there. 16 type of medicines and around 24 tablets every day she is taking. And when we start clinically supported lifestyle correction, we stop all the diabetic medicine the first day itself. And the other BP medicines, we are monitoring BP at home, and when the BP is come down, accordingly the BP medicine also coming down. When she came for the 8th day visit, her medicine was come down to 9 numbers, and only and the HbA1c level is come down from 7.1 to 6.9. That is within a week without medicine. That was with the medicine. And next is 15th day, HbA1c has come down from to 6.6, and day 30, HbA1c come down to 5.8, and day 60 it is come down to 5.2. So all the time the blood sugar is maintaining normal only. And most importantly, for 90 days also, her HbA1c is 5.4. That is slight fluctuation. Is after 5.2, it may not be going down because they will be more relaxed on the food and it will be slightly. And also she had CKD, that kidney also was affected, and GFR was 42 initially. On the 8th day, GFR increased to 47, and 15th day it has come down to 50, and 30th day it is increased again to 55, and 60th day it is 60, and 90th day 66. So it's some patients the kidney function increase very fast. Actually, she's 75 years. You should remember that this is a 75-year-old lady. And when we initially looking into her body age, it was, say, if she's only 75, it is more than 80 actually. The machine read only up to 80. So that actually from the 30th day, the body age came down to 75, 60, 73, 90, 71. And when she came on 180 days, that is 6 months, her body age came down to 66 actually. So the results are really amazing. Only thing the patients should be willing to follow as said, and they should have a moderation in food and do the exercise. And this exercises that is in this pattern used is only on lying down or in the sitting position. The exercises are on the lying down position or in the sitting position. So it is not only one disease, whatever diseases are there, it is parallelly getting corrected. And because we are actually correcting the body composition and the immune system we are correcting. That is why this type of result we are able to achieve. The focus of clinically supervised lifestyle modulation is not on the symptoms. The focus is on the lifestyle parameters to be corrected, to set it right. The undesired variations in body composition, hormone activity, circulation, immune status, etc., which are at the root of one or more lifestyle diseases. This explains why patients can simultaneously get relief from multiple diseases, multiple symptoms, and multiple discomforts. We should understand that the basis of recovery from disease is the self-healing power of the immune system. The goal is to create the optimal environment for the immune system to stimulate this self-healing power. Everyone should try to self-modulate their lifestyle to optimize health. When this is not possible, or when suffering from a serious condition, or when suffering from multiple disorders, or taking chronic medication, or suffering from ill effects of chronic medication, or when surgery is under consideration, the need for clinically supported and supervised lifestyle correction becomes necessary. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, the treatment with the emphasis on the benefits of lifestyle correction from the website, and YouTube playlists. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding symptoms, current diagnostic methods and treatments, along with the benefits and side effects, practical aspects of lifestyle self-correction, and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostics, medical and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. Thank you.